Okay, here we have Dr. Thomas Irwin, and famous animal hospital specialist. Yeah. So he came in with some degeneration of his knees. We decided to do the laser stem cell stimulation procedure. And then, so we're about 6 weeks out. So what improvements, if at all, Tom, have you noticed after the procedure?
Definitely less pain. I was getting some real specific pain in certain areas of my knee, the weight-bearing surfaces, and that seems to have gone away. I still do get some stiffness. The amount of Advil anti-inflammatories that I feel like I need to take has drastically decreased. I used to have to take 600 to 800 milligrams a couple times a day to make it through the day because I'm on my feet all day. Now I didn't take any for the first 2 or 3 weeks. I occasionally take a single pill in the morning, especially if I do CrossFit and I'm starting to get back into that, and I know it's going to get a little dicey, so I do it once in a while. But I'm really thrilled about the decrease in the amount of Advil. And in general, going up and down stairs is easier. Going down is still a little tough with the landing, but going up is way better. So in general, I'm happy. I'm pleasantly surprised.
When you're doing your veterinary surgery and you're on your feet, are you able to stand longer with less pain? Or
I don't think I get as stiff when I'm done.
Okay.
I would usually, after I do the surgery, especially if I had like a 2 or 3 hour surgery, I'd walk around peg-legged for a little while.
Yeah.
They just went on a bend, and now they're not as bad. And I just go back in and sit in my office, put that light stim on, and
That's good.
Better almost immediately.
All right, Tom, I'm happy with the results. Like I said, my best guesstimation, you should be making at least 10% improvement a month. Here we are about a month out. You're like, I think, how many percent would you say?
I said about 20.
That's good. I think you're double what the typical slow healer would be. And then we'll keep on monitoring your progress. Today we'll give you the shockwave treatment just to stimulate the cells a little more. And we have it back in about 6 weeks, okay?
Okay. As far as CrossFit, is it, I've been
like I said, like me, I never stopped. What I did, I just avoided the movements that caused pain. Like,
okay.
I couldn't kip for months, so I would just do normal pull-ups.
With your shoulder, huh?
And then now I can do kips, but I just warm up extra,
Yeah, okay.
Uh-huh. And then
I've just been really careful on any loads that I put on my knees. It's been kind of fun. I've just been going light and do that.
Well, that's your excuse, right? Yeah.
Yeah, exactly. Hey, the doc said I couldn't do that.
If there's a box jump day, I would use the lowest box, and I would get the neoprene sleeves. The best are Rogue Fitness, the neoprene knee sleeves.
Oh yeah, I think I have Nordic lifting.
Yeah, but when you do, like, if you're doing like a box jump, I don't want you to stand up, like, how you extend.
Right.
No, just stay bent until it'll help upload take the load off the knee.
Yeah.
Don't lock them out. Squats are fine. As long as you're, using good form. I like to put the bar a little lower on the traps because it'll keep the weight on your posterior chain and off the knees. But you need good shoulder flexibility to do this. So
yeah,
like I said, when you have time, you got to come over and because I have a whole gym in my backyard. I'll just show you some stuff that I did. All right.
All right.
But yeah, keep on doing it. Just
okay, good. Yeah.
You don't want to try to compete with the young guys and gals, especially. Just let pain be your guidance. If you can get away doing something, and
so
you're
pretty much if it's not causing pain, we're cool.
I would full bore. Just check with me. Right? Yeah. Yeah.
Well, my full bore over the last. When I started, I wanted to set PRs and stuff, and now I just want to do. I want to do good weights with good form, and I'm not going crazy weights.
There you go. That's realistic. At 3. Yeah. In 6 weeks, I'll give you the go where you can go through. Yeah, you're probably good enough where you can go through a full WOD. You just got to modify it to your ability. Okay.
Yeah, I've just been. I wasn't doing jump ropes. I was just, cycling, and I just modified stuff and the weights on your 1 to 2 weeks, 3 to 4 weeks and stuff. I was, 50% of the weights with the guys were giving me shit, but it's like, hey, screw you.
There you go.
I also have 64-year-old knees. You don't.
There you go. And they'll probably be where you're at later. So yeah.
Yeah. I feel like you just wait.
All right, Tom, go ahead and get your treatment. We'll see you
All
in
right.
2 weeks, all right?
Cool. Thanks a
All right,
lot.
take care.